Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the truth about it, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Let's talk about the complications of diabetes, nerve damage, and sexual problems and infections. Your nerves are like telephone or electrical lines that help different parts of your body talk to each other. Diabetes quite often damages your nerves. Damage to the nerves is called neuropathy, which again is due to high blood glucose levels. When this occurs, the nerves do not send out their signals as well as before. Some of the signs of nerve damage occur in your feet and legs. You may experience numbness, a tingling sensation described as pins and needles, or you may have burning and aching. Sometimes the damage is so serious that injuries happen to your feet and your legs, and you don't even know that you've been injured. This is why uncontrolled diabetes is the leading cause of amputations. Uncontrolled diabetes can cause sexual problems through nerve damage. Men may be less likely to get or be able to keep an erection because of the damage to their nerves from high blood sugars. Women may also be less likely to have an orgasm. Your small blood vessels and nerve damage can make infections in people with diabetes occur more frequently. Poor blood flow and high blood glucose slows down the body's infection-fighting team called the white blood cells. Nerve damage prevents you from knowing when you injure yourself, so you might get a cut or a scrape that can lead to a serious skin infection if not treated quickly. The best way to treat all of these conditions, damage to the blood vessels, the nerves, sexual dysfunction, frequent infections, is to keep your blood sugar as close to normal as possible. That means getting that A1C to 7% or less. Through careful monitoring and taking your medication as prescribed, you can keep these complications to a minimum. Let's talk about the complications of diabetes. We know that people with diabetes that do not keep their blood sugar under good control can suffer from the complications of diabetes. These complications come from high blood glucose levels in the blood that causes damage to the nerves, the small and large blood vessels, and reduces the ability of your body to fight off infections. You are more likely than other people without diabetes to have problems with your eyes, your kidneys, and your feet. In addition, people with diabetes have a 2 to 5 times increased risk of heart attacks and strokes. You are also more likely to get infections and to have sexual dysfunction. Blindness can occur as a result of the disease process occurring in the eyes called retinopathy. Retinopathy is damage to the retina that's in the back of the eye. Although it occurs very slowly, eye damage is a very serious complication. In addition, damage to the small vessels of the kidneys results in nephropathy. Nephropathy is the medical term for kidney damage. The kidneys are important because they filter out the waste in the blood and pass that waste into the urine. High blood glucose and high blood pressure damage the blood vessels and the filtering ability of the kidneys. Damage to the filtering system of the kidney causes these waste products to stay in the blood. This is why people that have kidney disease, if it becomes severe, must go on dialysis. Make sure you get your eyes checked regularly by an ophthalmologist, at least once a year. Your doctor should be doing a urine test at least 2 or 3 times a year to detect the level of proteins in your urine. It is your responsibility to make sure you keep your blood sugar levels under good control so that you can prevent the complications of diabetes. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Did you know that almost 29% of people stop taking their medications before they run out, and 12% don't take the medications as prescribed? Diabetes and high blood pressure are chronic or long-term illnesses that will require you to take your medication for the rest of your life. Diabetes and high blood pressure medications are designed to keep your blood sugar and your blood pressure under control. If you are not on the right combination of medications, you can end up in the hospital with a diabetes coma, a heart attack, or a stroke. Everyone with diabetes needs to know their hemoglobin A1C level and get that number below 8%. This usually requires 2 or more medications, and some people will require insulin. You should always check with your healthcare provider before stopping a medication or changing to a different one. There are some common medications used in the treatment of diabetes that actually increase your risk for low blood sugar reactions or hypoglycemia. There are some common medications for high blood pressure that can increase your risk of developing diabetes by 33%. If you're a person with diabetes or have high blood pressure, check with your pharmacist when you buy the over-the-counter medications to make sure that they will work with the medications your doctor has prescribed. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power. Hi, I'm Dr. Lenora Coleman, president and founder of Healing Our Village, and I'm the executive director of a nonprofit called Total Lifestyle Change. And I am here coming to you live today from Atlanta, Georgia. I live in Jonesboro, Georgia, actually. If anybody lives in Atlanta, come on down here to Jonesboro, Georgia. I'm on Main Street. In Jonesboro, that's our sort of downtown here in Jonesboro, and I have a building at 177 North Main Street, and every Wednesday we do Wellness Wednesday. So come on down. We'll take your blood pressure, we'll do your blood sugar, we'll get you involved in all of our activities that we have here. We do COVID testing as well. So I am glad to come to you today live. For those of you who are watching me on Facebook, this is your opportunity to ask questions. I have somebody actually monitoring my Facebook page so that they're able to tell me what questions you may have about our topic today. And today we're going to be talking about the heart of the matter. This is our segment on hypertension and cardiac disease.
heart disease. Many of you out there have heart disease, and you may know it. A lot of people know what their blood pressure is. What they don't know is what their blood pressure should be. And so we're going to talk about the goals for your blood pressure today, what the signs and symptoms are, and how you can do a much better job at getting your blood pressure under control. I actually talked to a gentleman this week on Thursday. He drove 2 hours to see me, believe it or not, so I could help him with his medicines. And we took his blood pressure, and while he was here, and it was high. And when I asked him, "Did you take your medicine today?" he said no. And what I said is, "Well, sir, I can't help you if you don't take your medicine. Because if you don't take your medicine, then I don't know what your medicine is actually working or not working. So you got to take your medicine every day, folks." So I spent the next hour talking to him about ideas that we could come up together for him to do a better job at taking his medicine. And so this is so important. For those of you who have high blood pressure, you're probably on 2 or 3 medicines for your blood pressure. This gentleman was on 3 medications for his blood pressure, and all the doses were at maximum dose. So I knew he wasn't taking them, because if you're on 3 medications for your blood pressure and they're all at maximum dose, then your blood pressure is going to be under control. So when I take your blood pressure and then I ask you if you're on medicines and you say yes and your blood pressure's high, I want to ask you, well, did you take your medicine? But I know you didn't take it. That's just a rhetorical question I'm asking. I already know the answer to the question. The question is, you're not taking the medicine. And that's really important. So we're going to talk, for those of you who might not know everything you need to know about heart disease and about hypertension, we're going to do a deep, deep dive into that today. But before we get started, I want to just briefly talk to you a little bit about something called health disparities. You may have heard that word on the television, on the radio. Over the last 5-10 years, there's been a lot of talk about the fact that African Americans and Latin populations have a lot of health disparities. And what that means is that the health care that they are receiving, so that means the doctors they're able to go to, the hospitals they're able to go to, and when they get to those places, the level of care that they receive is as good as Caucasians. That's what disparities are. So there is a disparity between the kind of care and the level of health for folks who are Caucasian compared to people who are people of color. People who are African American, people who are of recent African descent, people who come from our Latin countries all over the world. So disparities are something that can be easily fixed. And let me tell you why I say that. Because that's what Healing Our Village does. We level the playing field. So the level of care that you're getting, maybe from your doctor, from the hospital, from the advice that you're getting from healthcare professionals, maybe it may be okay, it may not be okay. But Healing Our Village levels the playing field, because we're going to make sure that you understand exactly what you need to do to get your chronic diseases under control. That's our job. That's what we do. And we work with you on an ongoing basis until we get you there. That's what we do. So we are the answer to healthcare disparities. And so when you talk about it, it's disparities that are racial and ethnic differences in the quality of the healthcare. And it can be due to access issues. It could be due to the level of knowledge of the doctors that you're seeing. They may be brilliant or maybe not. All right, so it's the clinical care that you're receiving from your healthcare professionals. And it's also the appropriateness of what they decide to do for you. So doctors make decisions every day when they see patients. And they decide that they're not sure about something, and so they'll send you out for a lot of different diagnostic testing. And that helps them then come up with a diagnosis of what may be going on with you. So if you leave your doctor's office after going through your diagnostic testing and seeing that doctor for a while, and he's still or she's still not exactly sure what's going on with you, that's a problem. That's a problem. In 2023, well, that's a problem. You need to have an answer to your question. What's going on with me, doc? You need an answer to that question. It needs to be a very defined answer, too. Everybody needs to know what the answer to that question is, especially you. Because if I don't know what's wrong with you, then how can I treat you? So then I'm guessing. What I think you might have. And so now I'm going to do some trial and error. And you don't want doctors doing trial and error. They need to know what's going on, right? So this appropriateness of the intervention is really important, okay? So when you're then talking about these reasons for this disparity, they're super complex. There's a lot of reasons. And what's also important is it really depends on where you live. And I just want to say something out loud, okay? If you're a person of color in the United States of America, today, in 2020, 2023, we're in January. If you're a person of color in the United States of America today, you need to pick where you live. Because there are some places that are toxic, and you don't need to live there. I'm just going to put it out there. So you need to live in a place where the health and welfare of African Americans and Latino populations are at a high priority, and they actually care whether you live or die. And there are some places in this country where the health care is terrible. There are places that out there in rural America that don't have a hospital for 100 miles. You'd have to travel 100 miles if you had a heart attack to get care. And that hospital might not even be a level 3 trauma center hospital. It might take you more than 100 miles to get to that hospital. So if you're a person who has some chronic conditions going on, if you're in your late 50s, 60s, 70s, and 80s, you need to make sure that you're living in a place where you're going to have a good health care system. Because that is really important. It's really important. You also need to make sure that you're living in a place that's got good doctors that know what they're doing. Because you can do a whole lot of stuff in a doctor's office. I work with doctors right now that have x-ray machines. They can actually test your autonomic nervous system. They can test the flow in your carotid arteries. I mean, there's all sorts of technology is amazing. And we can do so many things that we couldn't used to be able to do. We can do those now right there in your doctor's office. They just have to purchase the equipment to be able to do the stuff. So you need to make sure that whatever providers you're going to, whatever clinic you're going to, they are fully equipped to be able to do everything that needs to be done right there on site. And if they can't, then that's a place you don't need to go. Because the solution to the problem for you should not be for them to say, well, we'll have to send you to wherever it is they're going to send you because we're not equipped here to handle that. That's your first sign that there's a problem with that care that you're getting, okay? And then you actually bear some responsibility. You the patient. You need to be knowledgeable about what's going on. You need to know what's happening with your body, with your health, and you need to decrease high-risk behaviors that can cause you to get sick. So for all you cigarette smokers out there, I can't cry for you when you get lung cancer because you're smoking cigarettes that on the pack it says it can cause lung cancer. I can't feel sorry for you. I'm just gonna be straight up. This Healing Our Village, we're talking real. We're what they say, keeping it 100. Okay, I can't help you if you decide you won't smoke cigarettes and then you get lung cancer. What am I gonna do with that? All right? I cannot help you if you are 100 pounds overweight. You can't walk because it's too much weight for your knees to be able to handle. And you continue to eat Krispy Kreme donuts. Coleman can't help you. I can't help you. I can't help you if you're having multiple sex partners, you doing unprotected sex in places where you know the HIV rates are high, and you get HIV. These are called high-risk behaviors. And I'm talking about this because a lot of what we see as it relates to hypertension and heart disease is because of poor eating habits, not getting exercise, and being way overweight. Those are big lifestyle changes that we could do in our lives. And let me tell you, you see me sitting up and looking at you. I need to lose 20 pounds badly. It's hard. It's hard. I'm 70 years old. I got two hip replacements. I just hurt my knees a couple months ago. It's hard for me to do as much exercise as I used to do when I was 20, 30, 40, 50, even early 60s. I'm up here to 70 now. It's different. It's hard. My metabolic rate has also slowed down because I've gotten older. So your body fights against you as you get older. Makes it even harder. So as a patient, as a person, I have to then figure out how I have to change my life to be able to achieve lifestyle changes. So every day I try to eat a little bit more healthy. Every day I try to figure out how to get more vegetables and fruits in my diet. I have to think about that. I have to think about it. It has to be intentional. So that's what I want you all as patients. You have to think about and discuss with your doctor what it is that you can do to make whatever it is he's treating better. You have to think about it and actually try to implement small changes so that you can get there. Now, when we talk about heart disease, and I really care about that, because when we look for African Americans, and Healing Our Village is really focused, has always been focused on African Americans and people of African descent. I know for a fact that when we start talking about heart disease, that there is a whole bunch of people in this country that have heart disease, right? The last time I checked, and this is about maybe last year I checked this number, it's 82.6 million. It's probably higher than that now, because it keeps going up and up and up and up and up. But you can see, if you look at this graph that's on the screen, you look at the red and you look at the black lines, those are African American men and women. So when you talk about heart disease, you're talking about African Americans. They're the ones that have it. That's why I care about those folks. Now, I'm going to do this one more slide, and then we're going to go to break. Let's just get into what is high blood pressure, and it's very common. And so what I'm going to do is I'm going to let you guys get up and get a glass of water, and we're going to take a break right now, and then we'll come on back. All right. Thank you.
Epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol in organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.
Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. What is the skinny about diabetes and the DASH diet? Recently, U.S. News and World Report ranked the DASH diet as the best for people with diabetes. DASH stands for Dietary Approaches to Stop Hypertension. We know that many people with diabetes also have high blood pressure. We know that African Americans have the highest rate of hypertension in the world. A recent study in the American Diabetes Association Diabetes Care Journal found that people with type 2 diabetes who follow the DASH eating plan reduce their body weight and improve their blood glucose, A1C, blood pressure, and other cardiovascular risk factors. The DASH eating plan is flexible and is well balanced. The plan recommends eating fruits, vegetable, fat-free or low-fat milk and milk products, whole grain, fish, poultry, beans, seeds, and nuts. It also contains less sodium, sweets, added sugars, and sugar-containing beverages, fats, and red meats that are in the typical American diet. The DASH diet is rich in potassium, magnesium, calcium, protein, and fiber. All of these are nutrients that can help lower your blood pressure. The DASH diet recommends the use of 3 servings of fat-free or low-fat milk products a day. For African Americans with lactose intolerance, you can use lactose-free products and still get the beneficial effect. In the DASH study, African American men who followed the DASH diet were able to get a significant reduction in their blood pressure. For more information regarding the DASH diet, go to healingourvillage.com. Do you have diabetes and cannot figure out what to eat? A balanced diet will help you keep your blood glucose levels in check. Look around you. How many overweight and obese people do you see? We now have an estimated of 160 million Americans who are either obese or overweight. Nearly 75% of American men and more than 60% of American women are obese or overweight. Nearly 30% of boys and girls under age 20 are either obese or overweight. So ask yourself, what's going on? Well, I can tell you, it's fast food and the fact that we're not getting our daily exercise. We know that African Americans and Latinos have especially high numbers, mainly due to what they eat. For people with diabetes, healthy eating habits are especially important.
The first step is to have your doctor refer you to a dietitian or a certified diabetes educator. Watch your portions. Eat small meals with lots of vegetables, small amounts of meat and poultry. Avoid cookies, candies, cakes, and other foods that are high in sugar. Try to drink at least 8 to 10 glasses of water per day. Try not to skip meals. Try to eat at least 2 to 3 meals a day and snacks. Never let your body get into what is called starvation mode. Try to eat your biggest meal for breakfast and lunch and have a small dinner. Consider having a soup or salad for dinner. Remember, it is still calories in, calories out. Men should eat about 1,800 to 2,000 calories per day. Women should eat about 1,200 to 1,500 calories per day. You need to start reading your food labels of everything you eat. Focus on the percentage of fat, sugar, and salt that is on the label. People with diabetes do not need to be on a special diet. Just think ahead and plan your meals with a little bit from all of the food groups. Let's talk about diabetes and exercise. When you have type 2 diabetes, physical activity is an important component of your treatment plan. Exercise makes it easier for you to control your blood sugar. Some of the common excuses why people do not exercise include, I don't have the time, I'm too old to exercise, I need special clothing to exercise, I have joint pain due to my arthritis, people at the gym will think I'm fat, I don't like to sweat. None of these excuses should you use to keep you from exercising. There are many benefits to exercising, which includes burning fat and calories. If you're doing what they call anaerobic exercise like weight training, it increases your muscle tissue, which raises your metabolic rate. Exercise has been found to reduce blood pressure, reduces your bad cholesterol, and increases your good cholesterol. It decreases your blood glucose levels and relieves your stress and maybe even depression. So here is your exercise prescription. You need to exercise at least 45 to 60 minutes per day, 5 days per week. This time can be broken up into several smaller sessions. You should include resistance training or weightlifting combined with aerobic exercise. Consider exercising after your largest meal. Walking is one of the best exercises. Get a fitness tracker so you can measure how many steps you're getting per day. The goal for steps is 1,000 steps per day. Consider doing exercise that you actually enjoy doing, like dancing, playing tennis, swimming, bike riding, hiking. Remember, including exercise in your daily routine will make a big difference in your diabetes control. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power.
but that means that your kidneys are not doing so good when you start to spill protein into your urine. The doctors, if you have high blood pressure and you have diabetes, they should be checking your urine for protein when you get that yearly checkup. That should be part of that testing. So we're doing checking you for protein. We know you have chronic kidney disease. If you have a whole lot of people in your family, you're of African American, you're recently maybe migrated here to the United States, first or second generation, and you have a lot of people in your family with chronic kidney disease that went on dialysis, we're actually about to do a study because they found that there is a gene that you might have that we didn't know about that might be causing your family to go into this renal failure. So we're going to be focused on that this year, because we know that African Americans have a higher death rate from kidney disease. Now let's talk about the heart. This is the anatomy of the heart, all right? You know that there is the blood comes into the heart. It passes through the lungs, it gets oxygenated, and then that oxygenated blood then goes out into the body to bring oxygen to the body. That's what the heart is there to do. And so that it pumping is getting that blood circulating so it comes into the heart and out of the heart, all right? So a lot of people have damage to their heart blood vessels, or they have damage to the electrical conduction that causes that heart to beat. It's an electrical pulse that is in your heart that causes your heart to contract. And if that electrical conduction gets messed up, then the heart starts to go into what they say fibrillation or flutter. So it's not beating with synchrony. So that's what happened to the football player that everybody knows about, right? That passed out on the football field, right? We just saw that. He got hit in an exact way that threw off the electrical conduction, so his heart wasn't beating lub-dub, lub-dub. And that, if you actually get a stethoscope and listen to your heart beat, you'll hear that lub-dub. If you just go up to the internet and Google heart sounds, you actually can hear the sounds of the heart beating. And if you mess up the electrical conduction, then the heart starts to flutter instead of just boom, 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 boom. It starts to go like this, and then you pass out because you're not getting enough oxygen to the brain, because that's what that heart does, is take that oxygen to all over the body, including your brain. All right? So that is why this heart muscle is so important to keep healthy. You got to keep the vessels healthy. You got to keep the nerve conduction healthy, so it'll be able to beat for your entire life. All right, very important. So when it beats, when that blood goes out into the body, it causes a pressure. As that blood is surging through the arteries, bringing that oxygen to your body, it causes a pressure against the wall of the artery. And so when you take your blood pressure with that blood pressure cuff and you pump it up to a certain level, when you start letting out the air in that cuff, what happens is that it basically shuts down the flow for a minute. And then as you let off of it, when that blood is able to go again through those vessels, that cuff is measuring that pressure against the wall. And it's measuring the pressure when the heart beats and when the heart relaxes. So it gives you two numbers. It gives you the systolic pressure when the heart beats, and it gives you the diastolic pressure when the heart is not beating, when it's relaxed. Okay. So normal blood pressure, the top number should be 120 and the bottom number should be 80. That's a perfect blood pressure. We start not being happy when your blood pressure gets up to 130 over 80. 130 over 80. That is our goal for blood pressure. It shouldn't get higher than that. If it gets higher than that, then we start talking to you about decreasing the fat in your diet. We start talking to you about losing weight. We start talking to you about eating more fruits and vegetables. We start talking to you about getting more exercise. That's what we start with. And then if those things that you try to do don't work, then we may give you a medication. And depending on how high that pressure is, I may give you a medicine right off the top because it's starting to get dangerously high. And dangerously high means the numbers are so high that it means that you're at risk of a heart attack or stroke. So I may start medication. I may start 2 medications right off the bat, depending upon what your number is. All right, so don't be alarmed if you go to the doctor and all of a sudden they want to treat your blood pressure right away. That means that your blood pressure is super high and they're worried and they don't want you to go to the hospital. Okay, now we know that pre-hypertension is that number in between 120 over 80 and 129 over 89. That's pre. If I can catch you there and change your lifestyle somewhat, I can get you back down to 120 over 80 or less. So you know, African Americans need to probably be less than 120 over 80. All right? And I know this for a fact because I went on medical missions to Africa. I went to Kenya on a medical mission and we took people's blood pressure in Kenya, all over the country. And their blood pressures were 90 over 60. 90, the top number was 90 and the bottom number was 60. Okay, so African Americans don't have high blood pressure. That's not what we have. So when we're now here in the United States and we're eating all these foods and doing all these things and under the stress and strains of just being black in America today, when you put all of that there, now our blood pressures are high. Yeah, our blood pressures are high. So you can make these things change a little bit by adopting a healthier lifestyle, all right? Making sure that you're keeping track of your numbers. So everybody needs a blood pressure cuff. You need to go buy one. Buy a blood pressure cuff. We sell them on our website. You can buy them from us. You can go to a grocery store, pharmacy. You can buy it at a pharmacy on the corner. Everybody who has high blood pressure needs to be taking their blood pressure at least 3 or 4 times a week. You need to know your numbers. Everybody needs to know their numbers. Really important. So we are doing a lot of work to make sure that as you're looking at this blood pressure, that we don't want the numbers to be high, because if they're high, if your blood pressure increases, your risk for heart attack and stroke increases. But we also can cause kidney disease. It can also cause blindness. All of that because of high blood pressure. Now, what causes it is narrowing of the arteries. That narrowing of the arteries occurs because of plaque buildup from high cholesterol. So if the heart has to pump blood through a narrower artery, that causes it has to work harder to get the blood through, and so it causes the pressure to go up, right? That makes sense, right? So high blood pressure might also be caused by other problems like diabetes. So it's not just lifestyle. It can be because of other conditions that you have that affect your blood pressure. Now, when you're talking about heart disease and stroke, here's your blood vessel that we were just talking about. You can see that plaque, that white stuff that's on that artery, inside of that wall of that artery. You can see it's blocking the passage, so it's narrower. That's what that actually looks like. And if you have diabetes, that you having blockage of your arteries, the chance of that goes up. Diabetes causes all kinds of problems. So you're 2 times more likely to have a heart attack or stroke if you have diabetes and hypertension than if you just have hypertension. And if you've already had one heart attack, there's a good chance that you might have another one. So once you've had that first one, you've got to get real serious about trying to do what you need to do to make sure you don't have another heart attack. Now, when you're talking about the complications of high blood pressure, it's stroke. We just mentioned that. All right, that is a weakness in the vessels of the brain, where you then have a bleed, a blood clot in your brain. It blocks it, or that blood vessel breaks, and that is what a stroke is. Or it can go back there to the small vessels behind your eye and impair your vision. So your vision may become blurred because of high blood pressure. For your arteries, people as they get older, their arteries become stiff and hardened, right? So they don't move as well, especially in their heart, their brain, and their kidneys. And so that's why as you get older, we are really worried about your kidneys. We're really worried about your arteries. And so we're going to assess that through these diagnostic tests that I mentioned. Kidney damage. As I said, 2023, we're focused on chronic kidney disease. So all of the kidneys have small blood vessels. And those small blood vessels, if they get clogged or if those vessels break, then that causes kidney problems as well. So the kidneys don't work as well, and they don't filter out the toxins that are in your body. Heart attack, that's if those vessels in that heart, if one of those vessels break, then that could cause or a blood clot gets stuck in one of those vessels because the vessel is narrower. That can cause that part of that heart to die, part of that heart muscle to die because it's not getting enough oxygen. And there are people out there that have something called angina. And angina is one of those things that happen because the vessels are clogged and that part of that muscle in that area is not getting enough oxygen. And so that causes chest pain. And so in order to be able to deal with that, those patients put a nitroglycerin tablet underneath their tongue, and that opens up the vessels so that blood can rush through. And so that's the treatment of angina. And they have nitroglycerin patches, they have pills, etc. Now there's something called heart failure. So if your heart is working overtime because of you got hardened arteries, you've got clogged arteries, that heart is working overtime because of that over the years. What happens is like any other muscle, if you make that muscle work harder, that muscle gets bigger. Just like if you lift weights and you're making that muscle work harder, that bicep gets bigger. Same thing with the heart muscle. So if you're making that heart work harder to do the same work, it's going to get bigger. It's going to expand. It's going to enlarge. And the problem with that is for the heart, even though the muscle's bigger, it's not working better. It actually works less well. And that is heart failure. So now it doesn't pump as well as it used to pump. And as much oxygen doesn't get out to your body as used to happen. And so there's a lot of people who have heart failure, mainly in African Americans, especially because of hypertension. Now, how do you know you're going to have a heart attack? There are warning signs. You'll get this pressure on your chest. It feels like, people say it feels like an elephant is sitting on my chest. It's a squeezing pain. It lasts for a few minutes. It does not go away. Angina goes away. That heart pain goes away. A heart attack, that pain doesn't go away. And sometimes that pain goes down your arm, right? It feels like the pain is going from your chest and spreading down your arm. You might feel sweaty. You might have nausea. You might have shortness of breath. You might feel like you're about to faint. All of these are signs of a heart attack. All right? Now, there are some women, especially, that don't have those warning signs. They don't have the chest pain. They may feel like they just have indigestion. They got just, abdominal pain or stomach pain, or they might just be nauseous. But those are still the signs of heart attack for them. All of a sudden, your heart starts to beat really fast. All of a sudden, you get a cold sweat or you feel really pale. These are called atypical signs of heart attack, but it's still a warning sign that you're having a heart attack. Stroke, that has to do with that blood supply getting to the brain. So the blood supply to the brain is usually through that carotid artery that you see in that picture. It's on each side of your neck. And if the blood supply flowing through that carotid artery is stopped, even for a few seconds or a few minutes, it can lead to irreversible damage in the brain because the blood supply is not getting there. And if your brain doesn't get oxygen, that part of the brain that doesn't get the oxygen starts to die. All right? So that is why when people have a stroke, depending upon which artery it is in the brain, right? Maybe it's in the front of your brain, in the back of your brain, on the left side, on the right side. Where that happens will tell you what part of the body is being affected. So some people don't have any problems with their body. They're still able to walk and talk and everything, but they can't remember anything because the damage happened to their memory center of their brain. Some people, it's the left side of their body. Some people, it's the right side. It all depends on where the damage is happening. That's what this stroke is all about. So there's a lot of different types of stroke, two major ones. There's the TIAs, where these are these mini strokes, where just for a short period of time there's a lack of blood supply and it clogs up that artery in your brain for a short time, and those happen to people. People have those all the time. And we usually do blood thinners in order to be able to treat that. But if you have a major stroke greater than 5 minutes, you can have major damage to your brain. That you'll have to go into rehab and a rehab facility, and hopefully we'll be able to do occupational therapy and physical therapy to get you back. The signs of a TIA are sudden numbness or weakness in the face or the arm or the leg, sudden confusion, trouble speaking, you start to slur your words, sudden trouble walking or dizziness, having the worst headache you've ever had. These are all signs of TIAs. These are the signs of a stroke. That worst headache you've ever had is what people usually tell me. So when I say, so describe how it felt, that's what they'll tell me. Right? They had the worst headache they've ever had. And after the stroke, it's the memory loss. It's the lack of the ability to use certain parts of your body, especially your arms and your legs. And maybe you lose the feeling on one side. All right, so you may have people in your family that have had a stroke. You may know people in your church that have had a stroke, and you know that it is not something that you want to have. So if all you got to do is control your blood pressure and keep them numbers down, especially that top number, keep that number low, then your chances of having a stroke will also be low. Now to treat it, we want to treat these people to be sure that that blood pressure is less than 130/80, and we need to adopt lifestyles and the way that we live our lives to control our blood pressure. Let me tell you something. If you're a cigarette smoker, you need to stop smoking today. One of the main causes of high blood pressure is cigarette smoking. So you need to stop. That nicotine is bad. It's bad for you. It's the tars and all the other crap that's in the cigarette that gives you the lung cancer, but that nicotine is what's causing the high blood pressure. How do you know you have it? I told you need to go out there and buy a cuff. You need to buy a blood pressure cuff. You need to know what your numbers are. And you need to do it at least 3 to 4 times a week, and you need to do it at night around 8 o'clock, whatever, right when you're relaxed, the kids are in bed, you're getting ready to watch your favorite show, that's when you take your blood pressure. Because if it's high at night, it's super high during the daytime, for sure. There ain't no doubt about that. All right? We know that some people actually have what they call white coat syndrome. So when they go to their doctor's office, their blood pressure goes up. Their blood pressure usually isn't up, but when they go to that doctor's office, they're nervous, they're worried, I don't know. So for those patients, what we do is we give them what they call a Holter monitor. So we give them a 24-hour ambulatory blood pressure cuff that they take home, and they wear it for 24 hours, and then it's recorded, the readings, and then they bring that back to the doctor. The doctor can decide what's actually going on with your blood pressure. That's a really good way to make a diagnosis. How do we prevent this from continuing to occur? Well, getting to a healthy weight if you can, being physically active as much as you can, changing your eating habits to fruits, vegetables, more fish, more chicken, less fried foods, all of that helps. Sodium is critical. African Americans eat way too much salt. So just forget about decreasing the salt in your diet. Eliminate salt from your diet. I don't use salt. I have two big old huge things of salt in my cupboard, and I never use it because I use other kinds of seasoning. I buy like like Dash, or the ones that have all the stuff all mixed up, but it doesn't have salt, so it has herbs and spices all in one bottle. That's what I season everything with. I don't use salt. And so I would suggest that you all that have high blood pressure, you just take salt out of your diet and start reading your labels to make sure that what you're eating doesn't have a lot of salt in it, right? And if you drink alcoholic beverages, you need to do that in moderation. Smaller servings of the fish and the chicken and the turkey that you're eating. Roast or bake your foods. I have a hot air fryer. Anything fried I eat mostly now is hot air fried. I really like the way it tastes. It tastes just like fried food to me. And so I use my hot air fryer. I don't fry in oil at all. I really try to avoid fried foods. So I still eat them sometime. I do. But I don't eat them as much as I used to. All of this is about moderation. It's about moderation. Bacon, sausage, hot dogs, nuts, salad dressings, all of those have high amounts of salt. So you need to look at the labels, and when you go purchase a product that falls in that area, you need to buy the ones that, if I buy hot dogs, I buy turkey hot dogs. If I buy sausage, I buy turkey sausage. So I'm always, turkey bacon, I'm always substituting and switching out what I'm eating so it can be healthier. But it's still like it, so I want to be able to eat it. Preparing foods with less salt is just never cook with it anymore. We talked about lifestyle changes. In terms of your medications, there are many very effective medications for the management of your hypertension. Some of you are on what they call water pills. Those are diuretics. Every African American who has high blood pressure needs to be on a diuretic. Let me say that out loud again. Every African American that has high blood pressure needs to be on a water pill, on a small dose, because we know that we tend to hold on to salt and water. It's just part of our ancestry, and the fact that where the boat landed, everybody's got that same kind of problem, because those voyages took forever. And in order for anybody to have made the voyage, to have landed wherever that boat landed during slavery, your ancestor's body had to be able to hold on to salt and water. End of story, done, we're done. So that's why you need to have a little bit of a diuretic, water pill, to get rid of that excess water and salt. Beta blockers, that slows down the heart rate. Very important for those people who have heart failure due to hypertension. They're on beta blockers. All right, so those drugs need to be there if you have both of those going on. ACE inhibitors, angiotensin antagonists, those are your lisinoprils, those are your losartans, just to name a couple. The ACE inhibitors, the end of the drug name ends in pril. The angiotensin antagonist, the end of the drug name usually ends in tan, okay? If you have diabetes and hypertension, everybody needs to be on one of these drugs. If you have hypertension and diabetes, you need to be on either ACE inhibitor or angiotensin antagonist, because they help you not damage your kidneys. And kidney damage is very common in people that have diabetes and hypertension. All right, so they usually are on these medications. Calcium channel blockers, a lot of you are on amlodipine. Amlodipine and the calcium channel blockers, nifedipine, those drugs are very good in African Americans. There are studies which have showed that if you got to pick a drug class to be on, if you're an African American with hypertension, you need to be on a calcium channel blocker. Okay? Alpha beta blockers are very commonly used, again, with those patients that may have hypertension and heart failure. Nervous system inhibitors and vasodilators aren't used very much now in 2023. So those other classes are used much more commonly than we see. But there are some people who have very, very difficult to control high blood pressure that may be on either a vasodilator or a nervous system inhibitor. So this is a very busy chart, that talks about what do you need to do. And basically on the left side of this chart is talking to you about your eating plan. It's talking to you about weight reduction. It's talking to you about physical activity. All of those are lifestyle changes that we want you to do. And so it's very important that you do those things in order to be able to improve your blood pressure. If you think you're having a heart attack or a stroke, I want you to not overthink it. If you have those symptoms that I said, you're going to call 911 and the ambulance is going to come to your house, pick you up, take you to the emergency room. All right, there are so many people that die at home of a heart attack and stroke because they're waiting for their family member to get home, or they think it's just the flu, or it's this, or it's just that. All right? And let me tell you this. Now that we've had COVID, and all of you out there who are still living and didn't die from COVID, but you got it, all of you who have had COVID, now your lungs and your heart and your whole system is changed because of that virus. And many of you are still going through what they call long haulers. So they got long COVID. So now before you didn't have all this shortness of breath, but now since you've had COVID, you now notice that don't have as much energy. You get tired faster. You got shortness of breath faster. All of those is because you had COVID. And you decided not to take, especially for those who decided not to take the vaccine. Right? So you ended up getting it, and that COVID really set in there and really damaged your cardiovascular system and your pulmonary system. So that's your heart and your lungs. So now if you have these symptoms, you really need to call 911 because now your body's not as well equipped to deal with this stuff as it was pre-COVID. A lot of people don't know that. So it's very important that if you think you're having a heart attack, you call 911. You do not get in your car. You do not drive yourself to the emergency room. Because when you walk into an emergency room, they're going to give you a clipboard, have you fill out some paperwork, and tell you to sit over there, and they'll call you. People have died in the chair at the emergency room. I'm not playing, folks. I'm telling you the truth. So if you're going to go to an emergency room, you go there in an ambulance if you're having a heart attack or stroke. Because when that ambulance pulls up to the back of that ER, them folks is running out there to come get you. They're not talking about sitting in a chair and we'll call you. Right? So if you got to get there, you get there like that. Very important. Very important. So I wanted to let you know that this is the end of Sugar Busters Heart of the Matter. I hope that you learned something today about hypertension, about strokes, about heart attacks. All of this is on my YouTube channel. If you want to see this again, or you really enjoyed it but you missed something that I said, go to YouTube, Healing Our Village Official, and all of it's on demand right there. Go to my website, HOV Health, like and subscribe to my web pages so when I come to you live, it'll say Healing Our Village is live on your phone, and you'll know that I'm about to tell you something you need to know. It's very important. All right, I come here as much as I can on Saturdays. We're live, I think, most of the Saturdays on the month, but it depends on my travel schedule. But we will show you a pre-recorded session every Saturday. We have the Sugar Buster series is 7 parts, so you need to watch all 7 episodes. Don't miss any of the episodes because they're all important and there's things that you need to know. We have a new weight loss program that we're trying to get out in the marketplace called Step Up 90. If you need to lose weight, please call our 800 number and we'll get you hooked up with the platform. There is a charge for it's $19.99 a month, almost $20 for the advanced program, but for the basic program it's only $6.99. It's really inexpensive, and there's videos, there's recipes, it's all on your phone, it's interactive, and you also get your own lifestyle coach that we will assign to you. So if those of you who was January, your New Year's resolution was you were going to lose weight this year and you're going to get healthier, that's what Healing Our Village is here to do, to help you do that. As I said, we have blood glucose monitors. We have blood pressure monitors on our website that you can purchase, as well as our Village Club membership that we are offering for those who don't have health insurance, or even if you have health insurance, but you want your own healthcare team that you can call on a Saturday and ask a question, right? If something's going on with you. So that's really important. Every Wednesday, we're here at the building. We're doing Wellness Wednesday. You can come in, we'll take a blood pressure, we'll take a blood sugar, so that you can know what your numbers are. We'll get you all signed up for our classes and let you know about any events that we're having throughout the month. We also do COVID testing here throughout the week. COVID's still here, folks. COVID hasn't gone anywhere. So you need to know, especially if you're in situations where you're around a lot of people, if you know what your COVID status is, and make sure that you know what it is on a regular basis, because you do not want to get this new variant, and it's very contagious. Here is all our information. We're at 177 North Main Street. 800 number is 788-0941. There's someone here Monday through Friday to answer the phone. Our website is full of information. Our YouTube channel has tons of videos for you to watch and learn about. And our Village Club is something that we need you to join. It is a membership club where, again, you have your own doctor, nurse, pharmacist, dietitian there for you. And we can help you get and become the healthiest you that we can make you become in 2023. So we really encourage everyone to join Village Club. It's $150 for the year, right? That's less than you're spending if you buy a Starbucks Venti every day. Trust me, because I know how much they cost. So you got to put your health first. This is a new year. We're really hoping that you elect to live and not die, and that you want your family to be there next year. Be there for Thanksgiving and Christmas. And so you know who they are in your family that need this. Give it to them as a present. The present of life. It's very important. So I want to thank you again for today, and we will be here next Saturday trying to heal the village. Take care. Hello, I'm Dr. Lenore Coleman, President and founder of Healing Our Village. Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90, weight loss and diabetes prevention program, all in one. Finally, there is a guided mobile app that will help you lose 5 to 7% of your body weight and help you get your 150 minutes of exercise in every week. All of this is available on your cell phone, notepad, or computer. To install Step Up 90, all you have to do is go to www.stepup90 from your phone or computer and hit the install button. Once the icon is added to your home screen, you can create a unique login and password, or use your Facebook or Google login credentials. Do you have prediabetes? Does diabetes run in your family? Well, once you log in to Step Up 90, you can take the diabetes risk test. If you score more than 5, you may be at risk of developing type 2 diabetes. Step Up 90 features the CDC-approved Prevent T2 program, along with their food log, fitness log, and action plan. All materials can be printed or downloaded for easy use. Our monthly calendar provides our virtual class schedule with a reminder 30 minutes before the class to help you remember. Are you looking for easy-to-understand lifestyle videos, healthy recipes, exercise classes, nutritional support groups, or a cooking demonstration? All of this is available with our premium package. The most unique feature of Step Up 90 is your ability to chat with your lifestyle coach, a clinical pharmacist, or a registered dietitian. These experts will have weekly office hours. They are there to help you achieve your lifestyle goals and manage your medications. Sign up today for Step Up 90. We have our basic package starting at $5.99, featuring our weekly Zoom classes and our premium package at $19.99. Step Up 90, it is time for you to step up.